Hey there, Shock Doc Medical family. I'm Dr. Rod, and welcome back to another episode where we break down the nitty-gritty of medical practice into something you can actually use, whether you're a seasoned doctor or just a curious mind. Have you ever wondered how a really thorough physical exam can uncover clues to serious underlying conditions? Today, we're talking all about examining mucosal surfaces, from the mouth to the eyes and even the genital area. Trust me, by the end of this episode, you'll have a roadmap that's as detailed as it is practical. Now let's set the stage. Mucosal surfaces might seem like just another part of a routine exam, but they're gold mines for information. Mucosal inflammation or ulceration can show up in a whole host of conditions. Skin diseases, systemic issues like graft versus host disease, or even drug eruptions. These areas often tell a story about what's really going on inside the body. And today, we're going to make sure you don't miss a single clue. All right, let's start with the mouth. Think of this as your first stop on a detective's journey. Here's what you need to get going. Gloves. Absolutely essential for maintaining a sterile environment. 2 wooden tongue spatulas or oral mirrors. These help you get the right angles. A gauze swab and a bright light, because if you can't see it, you can't treat it. Before you even start, make sure to ask your patient to remove any dentures. Simple, right? Now here's what to look for. Lips. Assess the outline of the vermilion border. It might look ragged if there's sun damage or if the patient has discoid lupus erythematosus, DLE. Palpate any tumors or ulcers to check for infiltration. Note if the lips are swollen, scaly, or cracked. And if you see a lacy white pattern, that could be lichen planus, LP. Hard and soft palate. Give these areas a close look. They often hold hidden clues. Attached gingiva. Check for bright erythema, what we call desquamative gingivitis, bleeding, or ulceration. These signs can pop up in conditions like LP or pemphigus. Buccal mucosa. Ask the patient to move their tongue to one side so you can inspect the opposite cheek, and then repeat for the other side. Use your spatulas if needed. Look for asymmetrical areas of erythema or ulcers, especially near broken teeth, or pigmented spots near amalgam fillings. The tongue. Gently grasp the tongue with a gauze swab and examine both the dorsal and ventral surfaces. Make sure to move the tongue side to side to inspect the retromolar region, sometimes called the coffin trap because it's a common site for oral cancer. Dentures. Lastly, if there are signs of trauma or unusual lesions, check the dentures too. Moving on to another crucial, yet sometimes overlooked area, the genitalia. Now, if you find mucosal lesions in the mouth, you should extend your exam to the genital region. And yes, I get it. This part of the exam can be a bit awkward, but trust me, it's important. Here's what you need to check. General appearance. Look for erythema, swelling, rashes, erosions, ulcers, or any changes in pigmentation. For female patients, assess the labia, including the folds between them, and don't forget to check the clitoris. Determine whether the labia majora and minora are clearly visible or if they're obscured by scar tissue. For male patients, inspect the scrotum and the shaft of the penis. In uncircumcised males, gently retract the foreskin to check the glands for any signs of tightening or abnormal changes. Palpation and discharge. Palpate to assess for tenderness or infiltration. Look for any discharge from the vagina or penis. Perianal and rectal area. Don't skip the perianal skin and rectal mucosa. They can also offer critical insights. All right, let's shift our gaze to the eyes, often called the windows to the soul, but also a window into systemic diseases. Patients with conditions like graft versus host disease or connective tissue disorders might show eye involvement. Here's your checklist. Eyelids and lashes. Check the lids for any violaceous discoloration. For instance, that can be seen in dermatomyositis. Inspect the eyelashes. Loss of lashes might hint at alopecia areata. Signs of inflammation or infection. Look for blepharitis or chalazions, which are common in rosacea. Assess for ectropion, where the eyelid turns outward, commonly seen in chronic erythroderma. If you notice ectropion and the patient's eye isn't fully covered when they close, that's a cue to refer them to an ophthalmologist. Other ocular observations. Is the eye red, sticky, or is the patient photophobic? Check for subconjunctival blistering or scarring. Gently pull down the lower lid to see if the sulcus, the space between the bulbar and lid conjunctiva, is retained. a loss of this sulcus or the presence of Seneca adhesions is significant. You can ask the patient to look laterally and then medially to reveal any hidden adhesions. So why does all of this matter? Well, a thorough examination of these areas not only helps us diagnose skin and mucosal diseases early, but also provides clues to systemic conditions that might otherwise fly under the radar. Whether it's detecting the subtle signs of discoid lupus, lichen planus, or even early oral cancer, catching these details can make a huge difference in patient outcomes. And for those of you in practice, these guidelines are here to ensure you're not just checking boxes, but truly connecting the dots in your patient's overall health. Now, I know we didn't dive into specific treatments or medications today. This episode is all about detection and examination. But remember, once you've identified any abnormalities, it's crucial to follow up with the appropriate diagnostic tests and, if needed, refer your patient to the right specialist. Always stick to the latest treatment guidelines, and if you're ever in doubt, consult with your peers or specialists. That wraps up our deep dive into mucosal examinations. I hope you found this walkthrough as fascinating and useful as I did. I'd love to hear your thoughts. Have you noticed any of these signs in your practice? Or maybe you have some tips of your own? Drop your comments below and join the conversation here on Shock Doc Medical. If you enjoyed this episode, please hit that subscribe button, give us a like, and share it with your colleagues. And hey, stay tuned, because next week we're uncovering another groundbreaking topic that might just change the way you approach clinical exams. Until then, I'm Dr. Rod, reminding you that a thorough exam can literally change lives. Stay curious, stay sharp, and keep exploring the amazing world of medicine.